Good afternoon. I'm Anneke, a senior at Oregon State University in the Bioresource Research Program. I've been working with Dr. Melta Musa and Dr. Balls Fry of the Linus Pauling Institute here at OSU on a research project entitled The Inhibition of Alpha Amylase and Alpha Glucosidase by Bioflavonoids. The overarching theme for our research is type 2 diabetes mellitus, which is characterized by having a fasting blood glucose level greater than 126 milligrams per deciliter. Two of the key players in type 2 diabetes are the enzymes alpha amylase and alpha glucosidase. Both of these enzymes work in human digestion and break large complex carbohydrates down into small glucose molecules that the body can absorb. We're interested in inhibiting these two enzymes. There are pharmaceutical drugs currently on the market that do just that, but they're expensive for the patient and tend to have severe side effects. So we're interested in looking at the role of bioflavonoids, which are plant extracts, and the role that they have in inhibiting these two enzymes. We test our bioflavonoid compounds through a series of methods, both for alpha amylase and alpha glucosidase. We begin by mixing our test compound with the enzyme. After a certain period of incubation, we add our substrate. At that point, we're able to measure the enzymatic activity. We take this enzymatic activity and plot it on a graph versus the concentration of our inhibitor. At the 50% inhibition, we're able to see the concentration of our inhibitor, and at that point we calculate the IC50, or the inhibition concentration at 50% enzymatic activity. Here are some examples of graphs that we would get back from our data. Acarbose is a current pharmaceutical drug on the market, and we use that as our positive control. Across the y-axis shows alpha amylase activity as a percent, and across the x-axis is the concentration of our inhibitor. Acarbose typically gives an IC50 right around 8 micrograms per milliliter. For alpha amylase, we tested several different compounds, both as extracts and as pure compounds. Japanese knotweed extract, at first glance, looks as though it would be a great inhibitor, but the x-axis is quite different from our positive control, and the IC50 of Japanese knotweed extract is closer to 10 micrograms per milliliter. For grapeseed extract, we found similar results, also at 10 micrograms per milliliter. The pure compounds we tested, both resveratrol and epicatechin, although they showed some inhibitory activity, it was very slight and not nearly as close to the inhibitory activity as our positive control. For alpha glucosidase, we also used acarbose as our positive control. Alpha glucosidase activity as a percent is listed across the y-axis, and concentration of our inhibitor across the x-axis. Now, we tested extract compounds with this as well, and although the green tea extract graph seems as though it has less inhibition than our positive control, again the x-axis is quite different. Green tea extract gives a typical IC50 right around 0.6 micrograms per milliliter, compared to our positive control, which gives an IC50 close to 101 micrograms per milliliter. Grapeseed extract is also very effective, right around 1.5 micrograms per milliliter. We tested some pure compounds. Epigallocatechin gallate is very effective, with an IC50 value right around 0.1 micrograms per milliliter. Gallocatechin gallate was also effective at 1.5 micrograms per milliliter, and epicatechin gallate was effective at 15 micrograms per milliliter. In summary, for amylase, although we found that extracts were more effective than pure compounds at inhibiting the enzyme, none of the compounds or extracts tested were more effective than our positive control. When it came to alpha glucosidase, all of the extracts we tested were much more effective than our positive control, and several of the pure compounds were very effective as well. In conclusion, these results show that there are bioflavonoids that could be used and could be tested in vivo for their potential in inhibiting alpha glucosidase and alpha amylase activity. I'm fortunate for the funding for this research provided by USANA Health Sciences, the Oregon State University HHMI program, and undergraduate research, innovation, scholarship, and creativity here at OSU.